Hello, and welcome to the CMS National Training Program podcast, brought to you by the Centers for Medicare and Medicaid Services, or CMS. We're here to help our partners and the public better understand CMS programs. The information in this podcast is not legal guidance or intended for press purposes. Official Medicare program legal guidance can be found in the relevant statutes, regulations, and rulings. With that said, I am your host, Michaela Wright. From time to time, CMS gets questions about various topics, and today we'll answer a few of those questions with the help of Daniel Simmons, our Medicare specialist. Welcome again, Daniel.
Hello, good to be here, Michaela.
Today we're talking about Medicare Advantage and Medicare Supplement Insurance, or Medigap, policies. Many people want to know, what's the difference? Can you explain?
There is indeed a difference, a big difference, in fact. There are two main ways to get Medicare coverage: Original Medicare and Medicare Advantage. A Medigap policy only supplements your benefits if you have coverage through Original Medicare. There's never a time when someone would use Medigap and Medicare Advantage at the same time.
So they don't go together.
That's correct. In fact, it's illegal for anyone to sell you a Medigap policy if you have a Medicare Advantage plan, unless you're switching back to Original Medicare. If you're not planning to leave your MA plan and someone tries to sell you a Medigap policy, report it to your state insurance department.
And that's because if you have an MA plan, you don't need Medigap.
Right again, and I'll tell you why. As I said, an MA plan is one of the two main ways you can get your Medicare coverage. The other is Original Medicare, which includes Part A, hospital insurance, and Part B, medical insurance. A Medigap policy is supplemental coverage you can buy from a private company to help pay your out-of-pocket costs in Original Medicare, like your deductible and 20% coinsurance. Medigap fills in the gaps in Original Medicare.
So Medigap is something you could get in addition to Original Medicare, but an MA plan is something you could get instead of Original Medicare.
Exactly.
Okay. If a Medigap policy is a supplement, how would you describe an MA plan?
Medicare Advantage is an all-in-one alternative to Original Medicare. It's a bundled plan that includes Medicare Part A and Part B, and usually Medicare prescription drug coverage, or Part D. Some plans may have lower out-of-pocket costs than Original Medicare, and some offer benefits that Original Medicare doesn't cover, like vision, hearing, dental, and more. The most common types of Medicare Advantage plans are Health Maintenance Organization, HMO plans, Preferred Provider Organization, PPO plans, Private Fee for Service, PFFS plans, Special Needs Plans, SNPs, and Medicare Medical Savings Account, MSA plans.
What happens if you have Original Medicare plus a Medigap policy, but you switch to an MA plan?
If you have a Medigap policy and join an MA plan, you may want to cancel your Medigap policy. If you do want to cancel your Medigap policy, contact your insurance company. If you cancel the policy, you may not be able to get it back if you decide later to leave MA and return to Original Medicare.
That's good to know. Okay, what about premiums?
If you have an MA plan, you have to have Medicare Part A, which is free for most people, and Medicare Part B, which most people pay a monthly premium for. That means if you enroll in an MA plan, you pay the MA plan's premium in addition to the monthly Part B premium. If you have Original Medicare plus Medigap, you pay your monthly Part B premium to Medicare, and you also pay the private insurance company a monthly premium for your Medigap policy.
Got it. And what does Medigap cover?
Remember, you can't buy a Medigap policy if you have a Medicare Advantage plan. But if you have Original Medicare, your Medigap policy pays its share of the Medicare approved amount for healthcare costs covered under Original Medicare after Medicare pays its share. Your Medigap policy can help with certain out-of-pocket costs like deductibles and co-payments. Some include coverage for a foreign travel emergency, up to plan limits.
Are there different types of Medigap plans?
Yes, Medigap policies are sold by private companies. With the exception of a few states, most Medigap insurance companies can only sell standardized Medigap policies identified by the letters A, B, C, D, F, G, K, L, M, and N. Some of these plans are no longer available to new policyholders or to people new to Medicare.
How do people figure out which Medigap policy is right for them?
You've got a couple options. Call your State Health Insurance Assistance Program, SHIP office, contact your state insurance department, or visit medicare.gov/plan compare, which you can also use to find an MA or Part D plan.
Excellent. Thank you for explaining the difference between MA plans and Medigap policies. This is really helpful.
Of course. And just one more piece of advice for listeners. If you have questions about your coverage or you're unsure about what type of plan you have, call your plan. Contact information is on the back of your membership card.
That's right. And that applies to any of the situations we talked about today. If your plan is unable to assist you, contact 1-800-MEDICARE or your local SHIP office.
I couldn't have said it better myself.
Well, thank you, Daniel.
You've got it. Always happy to help.
That concludes this episode of the CMS National Training Program podcast. Thanks for listening. You can find out more about MA plans and Medigap at medicare.gov and visit the CMS National Training Program website for more training opportunities and resources. Until next time, stay healthy and stay informed.